always think about is, as it's a part of type 3 hypersensitivity and its immune complex formation, it usually affects your vessels. As it affects your blood vessels, it will induce inflammation, so we will call it vasculitis. And in the inflammation, there might be several events of thrombosis which would cause ischemia. So one of the major keywords in SLE will be ischemia, and we will see why. So let's start with the signs, symptoms, and criteria. One thing you might see is a discoid rash. Due to decreased blood flow to your skin, there might be a formation of some skin patches because the skin doesn't have its nutrients, and therefore the skin might pale off a little bit and form a discoid shape, and eventually this can even lead to scar formations. This is usually seen in head areas, in the forehead for instance. Also, due to ischemia to your mucus or even skin, cells will not get their nutrients. These will start to die out, and this will lead to ulcer formations, and usual sites of this are in the mouth area, so you will have some oral ulcers. You can also see photosensitivity, essentially that you're sensitive to light, and this brings us back to one of the environmental factors that can induce SLE. So you will start to get more skin patches and different ulcers and scars, usually on the face. SLE can also induce arthritis. Arthritis is essentially joint inflammation. This can affect any joint, but it's usually more specific to hands and wrists. But although there is excessive inflammation in your joints, this usually does not cause cartilage destruction, so the problems of arthritis will not be that severe if you would compare it to another autoimmune disease such as rheumatoid arthritis, in which the cartilage would be damaged and cause permanent damages. One of the things you usually associate with SLE is malar rashes. Malar refers to butterfly shape, and this is usually seen on cheeks and nose. And the cause of this is essentially the same as discoid rashes, due to decreased blood flow, and also due to the fact that the immune complexes can sometimes deposit between your skin layers, between your epidermis and dermis, and cause blister formations on the face. The immune markers that we usually see are anti-histone antibodies, anti-double-stranded DNA, anti-Smith, antiphospholipid membrane, cardiolipin, and blood components. The ones that you should remember mainly is the anti-double-stranded DNA, because this one is the most specific when you refer to SLE. But if the SLE would be drug-induced, such as you remember, hydralazine, procainamide, and isoniazid, in this case, the usual antigen is the histone. So the antibodies are mainly focused on histone. As you remember from basic physiology, your brain and head requires a lot of blood. So, of course, one of the major affected areas is your brain. So, as there will be decreased blood flow to your brain, this can cause ischemia. There are many neurological problems that can be caused by this ischemia. The most commonly seen in SLE is headache, but it can also cause other problems such as psychosis, anxiety, depression, and many more. As SLE constantly causes inflammation, one of the things you will see in any inflammation essentially is an elevation of erythrocyte sedimentation rate, abbreviated ESR. This is essentially the sedimentation of your red blood cells in 1 hour. As you remember, your kidneys gets 20 to 25% of your total cardiac output, and when you have kidney diseases in connection with SLE, we prefer to call them lupus nephritis. Lupus nephritis can cause many different conditions. This is a very big topic, but we'll just briefly cover that. There are 3 types of processes that are involved: diffuse, focal, and membranous lesions. In this video, we'll just mention that what will happen clinically. Clinically, you will see painless proteinuria and hematuria. So you will see a certain amount of protein and blood in your urine. But as this causes many other different kidney problems, you will see other conditions such as glomerulosclerosis, stiffening of your glomerular membranes, and it can lead to other diseases such as nephrotic syndrome, And you will also, of course, see, since this is a kidney-related problem, you will most likely see hypertension. All of this can eventually lead to renal failure. As you remember, what you will mainly see in SLE is anti-nuclear antibodies, and if you do a test about it, you will see positive values of anti-nuclear antibodies. SLE can also go to your serous membranes. And which are your serous membranes? The easiest way to remember it is the triple P: your peritoneum, your pericardium, and your pleura. And we'll take an example of pericarditis. You can assume that if the pericardium is inflamed as it surrounds the heart, it will affect your normal heart contraction, because it will now compress your heart. When it affects the pleura, it can cause pleural effusion. When it affects your peritoneum, it can cause abdominal pain. SLE can essentially decrease all of your blood cells. When it decreases your red blood cells, we call it anemia. This anemia is also one type of a group of anemias called autoimmune hemolytic anemias. This will fall under our type 2 hypersensitivity in the first subsection, which is opsonization by cellular depletion. Here you will see that the antibodies will attach themselves to your red blood cells, and when your red blood cells will pass your spleen, they will get stuck in the bile rod cords, and then your splenic macrophages will catch them and digest them. So this will cause a decrease in red blood cell number. And in anemias, you will see different signs such as weakness and paleness. If there is a decreasement of your white blood cells, we call it leukopenia. And you can assume if you have a decreased amount of white blood cells, you're gonna be more prone to infections. It can even affect your platelets. The autoantibodies can come and bind to your platelets, and they will get stuck in the bile rod cords of the spleen and eventually causing the macrophages to digest them. This is seen in a condition called immune thrombocytopenic purpura. And here you will see other signs and symptoms such as nose bleeding, called epistaxis, and prolonged menstruational bleeding, and also an increase in duration of the bleeding, and this is a condition we call menorrhage. So how can we remember all of these signs and symptoms? We can make a simple mnemonic, and the simplest that we have found is dopamine rash. This will cover most of the diagnostic features that you will see in SLE. We can also see sometimes a condition called Liebman-Sachs endocarditis. This is essentially that the autoimmunity will affect your bicuspid and tricuspid valves, and this will cause vegetations. In this picture we see a summary of everything we spoke. What are the causes of death and treatments in SLE? As you remember, by its hematological problems, decreased level of white blood cells increases the chances of infections. So if it increases the chances of infections, it will increase mainly the infections that you would normally not get when you're healthy. And these are the types of infections we collectively call opportunistic infections. The similar types of infections are also seen in AIDS patients. So what can be an example